I'll quickly give an overview of what we're going to cover today. You can see there's a lot of small text on my screen. We'll go into more detail so you can see this and share it with everyone afterwards. But just the big picture first. So everyone will introduce themselves, but Claudia and I work at Hackney Council in a team called Change Support. So we sit sort of technically within ICT at Hackney, but supporting teams across the whole of the council with managing complex change. And we've done a lot of work because of that team's remit on pandemic response. And so when we saw the LOTI grant applications open for the COVID Innovation Fund, it felt really, really relevant to a lot of what we'd been thinking about. So how could we make the most of all of the amazing new ways of working that have sort of come about during the pandemic and make sure that they're sort of embedded as the new normal, because we know that they're critical for all of the vulnerabilities that existed in both of our boroughs before the pandemic, but have absolutely been exacerbated by it the last year. So it felt like a really, really good fit to us, and we're really, really grateful to be working with LOTI on this and for the support. But actually also really specifically because we didn't know Phil and Helena from Newham before we started. So Phil and Helena will introduce themselves, but they both work in public health at Newham. And just from our initial conversations, when we were looking for a partner borough to apply for this work with, it really became clear really quickly that we'd had such similar experiences from the pandemic, specifically in terms of the way that it has accelerated and improved lots of voluntary sector partnerships between council and voluntary sector, and made us all, I think quite a lot about what we should change in order to continue to make that partnership working as easy as possible, so that we can actually find preventative approaches and embed them into our system. So we're not just waiting for people to reach crisis and be eligible for statutory services, but how can we identify vulnerability proactively and get involved sooner? So that's a bit of the background as to how we came to be working on this. Where we're at now in the project is we've just completed our first 2-week sprint, and apologies in advance for lots of tech jargon as we go through, but we're sort of running this on the sort of LOTI design methodology. So we're thinking about our work in 2-week sprints. We've just finished our first one, which again in the jargon we call our discovery, which is research to everyone else. So what we've done over this fortnight, we've basically done all of our work together in workshops, and I think it's worked really, really nicely on this big mural board, which Claudia has expertly put together for us. So every time we've done activities, we put it here. So we thought the best way to show you what we've been doing is just to walk you through this board. So where do we start? So the 2-week project started with the 2-week sprint started with our initial problem statement, which I'll go through. And then what we've been trying to do during this fortnight is really, really hone that down to a slightly more specific problem that we can tackle together in a short period of time. And then really start to think about how do we actually develop some clear testable hypotheses that we can go into the next 2 weeks with, which starts today. So the initial problem statement that we talked about when we first met was, as I've suggested, like we know that cross-sector collaborative and holistic working is really, really essential if we're going to prevent residents from reaching crisis. And we also know that COVID has exacerbated so many vulnerabilities, and it's going to create different patterns of crisis in different formats. So that's where we started with how might we develop a preventative approach to support residents who are at risk of crisis. And in about the next 10 or 15 minutes or so that we're talking, we'll show you where we've got to now at the end of our discovery phase. But I think first I'll hand over to Claudia to talk a bit more about where we started in terms of understanding the problem.
Yeah, so we started with looking at the sort of overall what each borough looks like, so looking at our population and what the situation was like pre-pandemic and since the pandemic. So in Hackney, we've got a population of almost 250,000. We've got a very diverse demographic community. And in terms of pre-pandemic, what situation was like, we already had more than 3,000 households in temporary accommodation, around a third of households in poverty, and almost half of children in poverty. Since the pandemic, all of those existing issues have been exacerbated. We've had a massive increase in referrals to domestic abuse intervention services, huge numbers of food parcels delivered, and massive increases in claims for universal credit. We've also got about 21,000 residents who are clinically extremely vulnerable. And as that support starts to end now, then we'll see a huge transition for them, and needing to look at what that support looks like in the borough. So I'll just hand over to Helena, who's going to go through similar stats from the Newham side.
Thanks, Claudia. Hi, everyone. I'm Helena. I work in the public health team at Newham. So yeah, having a look at the kind of big picture of Newham. So population slightly larger. So we're looking at about 370,000, and this is actually set to increase by 2030 by 7.1%. It's London's most ethnically diverse borough. Looking kind of pre-pandemic, there was 40,000 children in poverty, 1 in 24 people homeless, and up to 36,000 working below the minimum wage. And the impact of COVID, so Newham's had the highest number of COVID death rate in the summer of 2020. We've got universal credit isn't enough for stopping families falling into poverty, so that's even with the uplift that was given. And 32,000 are on the CE visa shielding list of residents in Newham. I will hand over to Phil now.
Great, thanks, Helena. And I'm a public health consultant in the public health team in Newham, and these maps just illustrate just how challenging it can be for many of our residents in the borough. So that top left is fuel poverty, and we're good, aren't we, at putting words in front of poverty, like fuel, like food, like digital. For me, I think we can get rid of that word. It's just poverty, and it just illustrates just the extent of the challenges across both boroughs. Incidentally, there's Tower Hamlets in between. We have discussed as a project team asking Tower Hamlets to shift out the way so we can have a true partnership, but that's not possible, so we're just continuing to fade Tower Hamlets out. If we go down, Zoe, to that next one is deprivation, and what this illustrates is really we're not in a borough like Richmond where there might be pockets of deprivation. Deprivation is pretty universal across both boroughs. So you could look in any of our, in Newham, 8 community neighbourhoods. You could do it by ward. You could do it by super lower output area. You do it by road, probably do it by block of apartments. You will find absolute poverty almost everywhere across both our boroughs. And then if you shift top right, Zoe, then this is just a possible outcome of poverty, isn't it, which is loneliness. You could probably overlay that with digital challenges for those community members, and so you'll see in both boroughs huge efforts around befriending and issues around mental health. But all these things play out, don't they? And if you were a social prescriber, you would be very busy in both these boroughs. And the bottom right is just literally predictions of population increase for both boroughs looking forward into 2030, and we know that's going to be a messy mix of regen and new members of the migrant community and others. So we do anticipate these problems that Zoe highlighted at the start to escalate. So that's just a big broad picture of what the maps look like for both boroughs. And then is this still me, Zoe? Yeah, and then moving on, so what we've been able to do in both boroughs is identify some of our key issues. And in Newham, we know it's around housing, debt, employability, immigration issues. And we know that residents come along as quite complex bundles. They don't just present with one issue, they present with many. And so I guess the answers are twofold for the Social Welfare Alliance in Newham. The first one is to pop all our frontline workers through training programs. And so we've had over 700 tenancies on all of our programs around all those issues that I mentioned. But the absolute answer is to find really efficient referral pathways. If we get that right, then we get the best outcomes possible for our residents, because referrals are a bit like putting together a jigsaw puzzle, aren't they? So many factors at play. So what we've done is we've spoken to over 350 frontline workers from the key actors in the system, and they are members of council, both council staff, our voluntary sector and our health partners. Those are the three possible actors who could play a huge role in knitting together those referral pathways. And what we wanted to do was ask all our frontline workers some key questions. So if you can scroll up, Zoe, just for us. So these are the questions. Oh, no, the other way. Kiko. So what's really heartening is that first one. I'm expected to connect residents with council services. Yes, please, because the council has so many fantastic services for residents, and we have to put our hands up in Newham, and you may well do in Hackney, Claudio and Zoe, that it's not always easy to refer in, is it? And making those pathways easier for voluntary and health sector partners would be great. On the other hand, I'm expected to connect residents with VCS services. Yes, please, because we know the voluntary sector has so many brilliant partners that can wrap around support for all of our residents after the issue that's presenting initially. I'm just admitting Dennis to the and so the big questions are highlighted in yellow. So it's easy to make referrals into the council and the VCS. We really need those figures if we're really to look after our most vulnerable residents to be up to 90, really ambitious, but that figure has to be really high because we need to make referrals easy, because referrals are like almost a sprint relay in the Olympic Games. Everyone's got a role to play, but that baton must be passed on. What's really heartening is I regularly work with colleagues outside of my team to support residents. That's 59 and 69. So what's interesting is just how similar the responses are between both boroughs. But we need that figure to be even higher, because if you're silo working, then you're not going to holistically support a resident. And then the other, I find it frustrating when other services make it half my team support residents. Great, because it should be. That should be a really high figure. But the figure we need to lower is other teams regularly make it hard for my team to support residents. We need that one to dip to 10. So this later on, Helena's going to show us that this will play out in the project KPIs. But unless we have sufficient referral systems where residents do not get lost in the system, and that all systems partners across the VCS, the council and the health partners understand that they are part of a handover of residents to the next support service, unless we get that absolutely spot on, we're going to see people slipping through the net and people not getting the sorts of support they deserve. And when those issues escalate, they become more costly, not only for that vulnerable resident, for the system as a whole. So someone becoming homeless leads to eviction, kids into social care. You can only start adding up a catastrophic list of costs. So unless we change those figures, if you can just refocus Zoe back on the yellow ones. So unless we can go, so it's easy to make referrals to count. We need that to be 90. I regularly work with colleagues outside my team. Yes, please, we need that to be 90. Other teams make it half my team support residents. We need that down to 10. We can accept a margin of error, but unless we get this right, we will never look after the escalating number of residents who need our support in whatever topic we choose. So this is absolute the bullseye part of this project.
Thanks, Phil. And just really quickly to say, like, what we started with this really wide problem statement and this survey, and I think we can share around the survey for anyone who's interested, the wording of it for other boroughs in particular. But we went really, really wide. We tested about 30 different statements here. We asked all sorts of things about support from your manager and training and all sorts of other things, and referrals just came out completely top. So we've just pulled out some of the strongest things here, but it came out very clearly to us from the survey, rather than us expecting referrals to be the driver when we went into it, which I thought was really interesting. So I'm going to hand over to Claudia.
Thanks. So I think you might have also just seen that some of the priority areas that people picked out were around housing, no recourse to public funds, finance and benefits, and mental health. And what we wanted to do next was think about where do we want to really focus this project. So we're looking at preventative work, but with this limited time, and in a sort of deep dive approach, where we want to trial this and then try and apply that across different areas. So we looked at different sort of cohorts and populations who we might be able to test this approach with, who have multiple needs, specific to who might be specifically impacted by COVID as well. So people who are bereaved by COVID, people who've been furloughed or recently entering unemployment, and people who've been shielding and maybe coming out of lockdown after a year of shielding. And what we did was compare those on this sort of bullseye map and think about the opportunity for improvement through this particular project, whether there's already existing support or existing services or projects going on in our boroughs around those areas, how effective that group might be as we transition out of COVID, and also the level of need in the boroughs, so the number of residents for each of those groups. And having done this, what we actually decided to do was, rather than focus on one group for both boroughs, so if you could just go to the left a bit to the those orange ones, was actually think more broadly. Well, these are all people who are who sort of require support from multiple different services and have complex needs, multiple complex needs. And in Newham, there's a higher priority to focus on people who are newly unemployed. In Hackney, it's maybe people who are related, people who are CV and transitioning out of lockdown. So while we're focusing on different cohorts, essentially the focus that we have is the same, which is how can we support individuals with multiple needs to find support, and how can we do this through collaborative multi-agency working. So we then looked at defining the outcomes for the project based on these, and picked out outcomes based on the individual. So residents have confidence to seek and engage with services to help them transition out of COVID. Frontline team outcomes, so making it easier, those three things that Phil just picked out really. So easier to make referrals, working regularly with colleagues, and making it easy for other teams to refer into you. Then community focus, so helping residents to engage with local community offers and enabling residents to go back to pre-pandemic interactions, so really focusing on their social relationships as well. And then a goal for the local authority, which is to prevent residents from requiring statutory support. So really building in that preventative side. If we can link people up elsewhere into other services and support them early on, we stop them from reaching crisis and needing statutory support. So I'm just going to hand over to Helena now, who's going to talk about how we then redefine that initial problem statement we set out at the beginning.
Yeah, thanks, Claudia. So yeah, based on everything, so all of that kind of bigger picture research we did, and then what came through the survey, we've redefined the problem statement to kind of really narrow it down. So it's how might we support people with multiple needs as we transition out of the pandemic. So that's what Claudia said, those cohorts of people. Developing a referral process that enables a holistic and collaborative multi-agency approach. And the thing is, in order to prevent them from reaching crisis. And as Claudia just spoke through, we're going to measure this through the three groups. So what does this mean for the resident and the community? What does this mean for frontline teams? And those are statements directly taken from those survey questions. And then what's the outcome of this for the local authority? So, you know, is this going to stop those residents needing statutory services by working in a more collaborative way? So I will pass back. Is it back over to Claudia?
Yeah, I think. Yeah. Thanks everyone. So you can see there's a lot here, and obviously a really key focus for us is staying in scope. So there's a lot of things that the whole systems might have to do in order to prevent people from reaching crisis. So we're really focusing on getting the referral process right, and I'm sure for lots of people on this call, you would have spent countless hours in meetings trying to work out how to get referral processes right. We know that it's hard, so we really wanted to go as deep into this as possible. So what we're not thinking about is the actual support received via a referral, but the access to the support itself. And obviously that's not as end-to-end as it might be, but we're very conscious that we've got a couple of months here, and so we want to be really, really clear now, and in all of our show and tells about what we're focusing on. So this is just how we went through breaking down the elements of the referral process in a bit more detail so that we could really focus on it. So and again, this has come from conversations with staff and with residents, and we will do much more of that over the next fortnight. But it's about having the right conversations first time. It's about being able to find the relevant services, so knowing what the options even are. And then it's about referring in the right way. So, you know, what information is required, what's the process for each organisation. It's sharing the right context. And again, anyone who's worked around this before will know that the one thing that residents always are very clear about is that they hate having to retell their story over and over and over again. So how do we tackle that element? Keeping the resident updated so that they don't lose faith in the system because they don't hear anything for weeks on end. And then also keeping the referrer updated. So if you are the, you know, the gas safety engineer who's gone into someone's home and they're worried about, say, domestic violence or child safeguarding or debt, and they've done the right thing and had the right conversation and made the right referral, how do we make sure to really do reinforce like the positive reinforcement with that person that they did the right thing and that they are contributing to the residents' well-being. So where do we think about our responsibilities to keep them updated as well? So I guess we wanted to show that because even just it sounds very simple and throwaway to say improve the referrals process, but even within just the referrals process, there are many elements to get right. And we went into even more detail on these purple post-it notes below, breaking this all down. So I will hand over to Claudia to quickly go through to next steps, and then I think we'll have time for questions.
Thanks, Zoe. So yeah, next steps, what we're going to do is build co-design groups within each of the boroughs made up of frontline teams. For example, in Hackney, that will include members from the COVID-19 helpline in the council and VCS organisations, and in Newham, they're working with our Newham Works and also some VCS organisations. And our first step will be to work with them to identify specific residents with multiple complex needs who we could focus this pilot around in terms of the support, and then develop a referral pathway map with that group and also the relevant services. So say, for example, one of those residents needs support from housing and also from adult social care, we would bring them in as well into that pathway mapping process. And what this will give us is a set of principles and co-developed pathway map to feed into some solutions we're already developing and testing, and sort of helping to guide those. So that includes a digital tool that is being developed in Hackney to help frontline teams find services and then refer to services, and also help guide peer support sessions, which we're going to be testing in Hackney, looking at sort of cross-team support sessions, so people from the council and healthcare and voluntary sector, and then from Newham's side, feeding into their training offer for all frontline staff. So by the end of this project, we'll have a sort of updated and tested versions of all of these that we can then share across boroughs and share outside of Newham and Hackney as well. So in terms of those solutions that we'll be exploring, and in this sort of next phase of sort of development and delivery, what we'll be testing are, in terms of the training, whether well-delivered short training modules increase the number of referrals made, and for peer support sessions, whether the sessions, which are co-designed by users, can improve frontline staff wellbeing, their skills and engagement with residents. And in terms of the digital tool, testing whether simple technology can create streamlined and valuable referral processes, improving the experience for residents and also for the staff, and whether it can improve collaborative working, and whether it can show resources in the borough. Valuable resource to entrench knowledge shared in training sessions. So really trying to embed that holistic way of working through the digital tool. So the next phase will be, the last one will be the deliver phase, where we have this set of principles, and we'll talk more about that in future show and tells.
Brilliant. Thank you, Claudia and Phil and Helena. I'm aware that we've just talked at you at length there and showed you a lot of text and images on slides or on Mural. So would be really great. Yeah, obviously really happy to take any questions. Or if anyone would like specific bits of the detailed research that's gone into this shared with them, then we're really, really happy to, because we're very aware that all London boroughs are facing these two issues of supporting people out of unemployment and shielding. So keen to collaborate with anyone on here who would like to. Maybe questions, if that's easiest.
You're more than welcome to put questions in the chat if that works better as well. Can't see anything coming through, so maybe oh, we've got a hand up from Paul.
Okay, I'll chip in the absence of anybody else saying anything. So I'm Paul Cooper. I'm the head of homelessness prevention and advice within Newham. And I guess my question is, in an attempt to try and simplify the referral process for residents, is there a risk that we miss the detail that means that the referral goes through to the wrong place? So I hear very often, and I've heard it here, kind of like things like, we will talk to housing. Yes, and housing can mean so many different things. Housing is a different thing if you are a council tenant, if you are a social housing tenant with a housing association, if you're private rented, if you're in temporary accommodation, if you're homeless or threatened, and these things being quite broad. So when we talk about this, but it's housing, isn't it? And we're trying to make it as simple as possible by calling it housing. Actually, the back office aspect of that needs to be understanding enough of the complexities of the services that we provide to still direct it in the right place.
Yeah, absolutely. That came up so much, I think, in our survey and in the research we've done with staff so far, that they tend to get quite frustrated and just say housing as a blob can answer this, and there's obviously a much more complex system behind all of the details of someone's housing. And, you know, sometimes they might mean council tax benefit to talk about housing costs. So I think one of the things is really taking the co-design approach to really understand what people mean really when they say I need support with housing, and then also making sure that's reflected back in the training or in the digital tool that we're providing, which prompts users. Don't just send this to housing. Is this housing need? Is this private rental sector? Is this fuel poverty? Like, what is so hopefully helping staff across the system to get a bit more of a nuanced understanding of what they mean by housing, I think, is probably a key part of that.
And Paul, it illustrates, doesn't it, just how important the training is, and you're one of our ACE deliverers, and we kind of task you, don't we, with the three big questions being asked from the voluntary sector and other partners for you to answer, and it just shows how complex and how important it is for everybody in the system to understand it, because if we don't understand it, then referrals will go awry, won't they? And as you say, we'll end up not hindering, not helping the resident. And certainly on the training programs, thinking of the one we do around employability and income maximisation, we started off at 90-minute bite size, now we've made it 2 hours. Now the partners CAB, Community Links, and now Newham Money, who offer that course, we're now going to divide it up into 3, because each of those areas around employability, getting online to get your benefits, money management, they're all training issues in their own right. So it just goes to show how complex this area is, and the more we can understand it as system actors, so the health partners, the VCS partners and the council partners, who we went to, 350 of them, to try and unpick this, it just goes to show how important hopefully this project will be in ironing out some of those massive areas and issues.
And I think just one other thing I'd add on that is that we mentioned a couple of times about the quality of referrals, not just the number. So a good outcome of this is not just everyone sending their residents to everywhere else in the system without any sort of understanding or case management. You know, one thing that we hear a lot in Hackney is that improving referrals is not about telling every children's social worker that the right thing for their family that they're working with is apply for social housing, because we know that that's not a good referral. It's not setting the right expectations for the family. It's not supporting them creatively. So how do we set the right expectations for referrers and service users at the beginning of the process?
And then Zoe, there is a question now in the chat from Ibelin around, have you hypothesised further on the digital tool?
That's a great question. Claudia, do you want to jump in and say a bit more about where we are? No.
Yeah, so we've been, the digital tool is based on something we already had for a different service, which looked at presenting some different topics that you could discuss. So trying to help frontline workers have holistic conversations, and then also having a sort of repository for services and places to refer residents to. So we're basing it on that and kind of iteratively changing it. I think another one of the bigger questions around this is how can the digital tool, it's really in that third hypothesis, how can the digital tool support holistic conversations, because that needs to be something that's done in training as well as through the tool, because just doing it in the tool doesn't necessarily encourage people to have those wider conversations. That needs to be a skill that's developed and then prompted and supported through the tools. So that's a real focus of our testing at the moment. I think something else also I was just thinking about before, what Phil and Zoe were saying, is around relationships and thinking how, I mean, so much of referrals is about developing good relationships so that you understand the service, you know who to go to if you have a question, and you're not just sort of blindly sending out emails, maybe inappropriate referrals as well, and making sure that residents are having a really joined up experience. And that's another sort of question we've got around the peer support sessions. And what we're looking at is testing peer support sessions with a single team, which is more about reflective practice and how can that support teams, and then peer support sessions across different teams. So how can that both support reflective practice, but also build relationships. So we've got one peer support group, which has someone from a housing officer from Hackney, someone from Shelter, someone from a small VCS, a small organisation, someone from our early help centre, and what we're trying to see is like, well, how can this encourage them to talk to each other to improve referrals, but through through relationships. So yeah, there are other sort of smaller test questions we're looking at because we're doing it iteratively, but these are the main overarching ones related to this project. Hopefully that helps.
It says, well, the work we're doing on the tool is all sort of also working in the open, so I'm happy to share any show and tell slides with anyone who's interested.
And just a note, whilst we're waiting for questions from others as well, we'll share all the outputs from this work, you know, things that we hope other boroughs might be able to reuse. And as Zoe just mentioned, we'll share an update on the next phase of the project as well. Any other questions from or comments or queries from anyone else on the call? Take that as a no. So last call, I suppose, for anyone who would like to add anything, both from the project team and other boroughs as well.
I don't think anything from us, but yeah, thank you for coming, everyone. And if a direct email or something is easier after the call, yeah, very happy to be in touch.
Great, thanks everyone. We'll be in touch with another date for our show and tell, and we'll keep you posted via our